if that's helped. The time.
Good morning and welcome to the Adult Social Care and Public Health Select Committee. My name is Tina Cadell, Chair of this committee. Before we continue, I will go over some housekeeping. This meeting is being held in person at County Hall and is also being live streamed on the County Council's YouTube channel. The recording will also be available to view afterwards. Under the Council's protocol on the use of media equipment at meetings held in public, this meeting may be filmed, recorded or photographed. Anyone wishing to do so must inform me and ensure that it is done in a way that is clearly visible to everyone present. The wishes of any individual not to be recorded or filmed must be appropriately respected. A fire alarm test is not expected during the meeting. If the alarm sounds, we must evacuate County Hall behind me. In the event of an emergency, please make your way to the nearest exit and meet at the muster point located in the main car park. May I also ask councillors to please keep to the agenda and the important items that we need to debate. I reserve my right to draw debates to a close where councillors are straying from the matter in hand and into promotion of political groups or parties. Turning now to the first item on the agenda, I will ask Megan to provide us with details of any apologies and substitutions. Megan.
Thank you, Chair. I have an apology today from Councillor Malcolm Latache and substituted by Councillor Jack White. Thank you.
Thank you, Megan. The next item on the agenda is to agree the minutes from the meeting held on the 11th of March 2026. Are the committee happy to agree these minutes? Yeah, all in agreement? Yes, Councillor Clancy, are you in agreement? Oh, yes. Yeah, thank you. Okay, is that right? I need to sign on? Okay. Okay, can I ask members if they have any interest in to declare on items on today's agenda, please? Any pecuniary or non-pecuniary? Councillor Holliday.
I've got a non-pecuniary interest in that I'm a trustee of an older person's daycare centre, which does on occasion receive social services clients.
Okay.
But it's non-pecuniary, thank you.
Thank you. Councillor Holliday, you noted that? Yeah. Thank you. Updates from the Chair, I do not have any. Public question time, we have received no public questions. Moving on to item 6, local member issues, member questions. We have received no member questions. So moving on to the strategic and financial planning 2027-28. Leon, would you like to introduce this report for me, please?
Chair, I think I'm going to introduce the report,
okay.
if that's okay, Chair.
Yeah, Councillor Thomas, please feel free.
Thank you. Good morning, everybody. So Cabinet has considered the appended annual report that begins the budget process for the next financial year, which is 2027 to 28. So due to the election, we're bringing this paper slightly later than we usually would, but nevertheless, the overarching objective, as ever, is for the Council to set a robust, balanced and deliverable budget, and that remains unchanged. So the appended report in the papers, which starts on page 21, sets out in detail the financial planning context for the Council, in particular the implications of the Fair Funding Review and the long-term settlement from government. So the key highlights of the report are the starting point for budget planning is the budget position and the medium-term financial strategy, MTFS, approved by full council in February 2026, which is detailed in section 2 of the appended report, which you can find on page 27. You'll see this includes a gap of 35.927 million for 2027 to 28, which you can see on page 29 in table 1. So at this point, we then add a further year to our financial planning, and Cabinet has therefore agreed the recommendation to extend the plan to 2030 to 2031, adding a further gap of 42.954 million. This results in a total gap of 148.45 million, 148.53 million for the MTFS period. So the 2027 to 28 budget gap is based on the planning assumption of a 4.99 council tax increase in line with government assumptions. However, please do note that at this stage the council is not being asked to decide the level of council tax, and a council tax increase lower than 4.99%, however, will mean that we'll require more departmental savings than those included in the report. Every 1% of reduction in council tax means we've got to make about £6 million worth of additional savings. So this is particularly important in the context of the Fair Funding Review and the long-term funding settlement, and this anticipates very time-limited or very limited increases in government funding for 2027 and to 28 and 28 to 29. And you can see that in chart 1 of the appended report on page 26, if that's useful. So an increase in funding is mostly based on the government assumed council tax increase, of which the maximum, as I've just said, is 4.99%. So tables 8 to 10, which you'll find on page 37 to 38 of the report, shows the savings gap allocated across departments, and this is based on a methodology which you can see in paragraph 3.5 on page 36. Cabinet has agreed the key assumptions in its recent meeting, the principles and approach to budget setting as set out within the appended report. And they've also agreed the timetable that was set out in table 7, which you can find on page 35. I believe this is a fairly standard timetable that's been used historically. An important feature of the budget setting process is the provision for public consultation on budget proposals, and these will take place between October and December this year to enable consultation feedback, which informs the budget setting process in January. So Cabinet in October will consider and then agree the proposals for consultation. The Select Committee may in particular wish to note that the timetable confirms the intention to engage with Select Committees at 2 key stages within the budget process. They are, at this meeting in July, to return and seek the Select Committee's initial views on the budget process and provide an opportunity for the committee to input and shape the proposals being developed by the services. Then, in November, the Select Committees will have the opportunity to provide feedback and comments on specific proposals which will have been taken already by then to public consultation, along with any other views on the emerging budget. In addition, the Strategic and Corporate Select Committee will consider the final budget in a scrutiny capacity between January Cabinet next year and February Full Council on the 10th of February 2027. So, the recommendations for the Select Committee are set out in the covering report, which you can see at page 16 to 17, and in essence, these recommendations ask the committee to understand the Council's overall budgetary position and the saving targets for the services within the committee's remit. We want to consider the financial position of services and the overarching financial strategy of each area, and also to provide the committee's views on budget strategy for the areas that they're responsible for, including the areas to explore savings. So I'm joined by officers to answer questions on the overall financial position of the Council and the budget planning context. The Select Committee report refers members to the Council's 2026 to 2027 budget book for details of the financial strategy and key priorities of each service. Highly recommended bedtime reading it is too. This also provides detailed information about existing services planned within each department. In addition, representatives from the services are also available at this meeting to talk about or answer questions on the overall service strategy and priority, how this links to the budget and any savings and transformation initiatives, the service's key areas of risk, and initial thinking about the development of savings for the 2027-2028 budget, including opportunities to maximise efficiencies, deliver productivity improvements and increase revenue generation. So, finally, to conclude, the Select Committee's views on the matters raised in the paper would be welcome to inform the budget process for 2027 to 2028. Thank you, Chair.
Thank you, Councillor Thomas. Members can find the recommendations we are considering today on pages, as Councillor Thomas has said, on pages 16 and 17 of the report. Does the committee have any questions they wish to ask? Over to you. Councillor Clancy.
Thank you, Chair. I think it's a good report, a good start, without any doubt. I think, but to give the committee a greater oversight, there's obviously the large transformation project going on in this department, within this portfolio, which I have confidence will bear fruit and will deliver what the objectives of the council is, to deliver a better service at a lower cost, in essence. And I think this is what most councillors would want to do. But I think too, the actual savings targets are ambitious. We have to save many, many more millions. And I think to help inform this, it would be useful at the next meeting of this committee to have an update on the transformation and to get a little bit more detail on where we're going with it and to actually be able to highlight some of those savings in real and cashable terms. I think this would be of benefit to committee members because headline figures are very important, large multi-million pound figures are very important, but I think a level of detail would help us. Thank you, Chair.
Thank you, Councillor Clancy. And that is one of the things that we will be having straight after this meeting, after we've done today, is an update on all those things so that we'll be able to take that forward to the forward work programme. Councillor Smith.
Councillor Clancy has pretty much covered what I was going to say, that details of savings, even in vague terms, would be very useful because we've got a big amount of savings to make and it's difficult to see how this is going to occur. So thank you.
Thank you, Councillor Smith. Any other questions? Councillor White?
Thank you, Chair.
Councillor Knight? Right. No, Councillor White, then Councillor Knight.
Okay.
Just so happened to be a rhyme.
Lovely. No, thank you. Thank you, Chair. Thank you for providing the report. It was very detailed and in principle it sounds very, very good. Just for the next meeting, would it be possible to have a potential breakdown of currently what we're spending on different areas of care, so that on like home care, residential, just so we can drill into what the biggest expenses are to identify some savings further?
Yeah. We can actually do that in a specific finance briefing from the department, so if that is what is wanted.
Thank you.
Yeah, thank you, Jack.
Sorry, Chair. That is actually in that fabulous bedtime reading the budget book. So
there we go, Councillor
just
White.
as a pointer, if somebody's very urgently wishes to review that information, it's in there.
It's all in there. Yes, Leon.
Thank you, Chair. Yeah, just to build on the point there, clearly there's a lot of detailed information in the budget book document, and I can recommend it as bedtime reading. My children love it, in fact. The Ringer budget meetings are long and vigorous. I guess building on what Becky's describing is, if the committee wishes, I'm more than happy to do an offline session with each of you just to step you through an adult social care finance 101, if that would be useful for committee members, and then we can bring obviously the detail back here.
I think that would be very useful, actually, or even just a briefing note as what is specific for this particular committee. That would be very helpful.
Yeah, happy to do so.
Any other questions? Sorry, Councillor Knight, please.
Thank you, Chair. In point 5, evidence and reasons for decision, 5.2 says that it remains essential to continue to engage with government, MPs and other stakeholders to campaign for adequate and sustainable funding. I was just hoping for more details on how this council intends to campaign for that sustainable funding.
Do we have anyone that can answer?
Perhaps if I can ask one of the officers to give an overview of the funding. In terms of actually campaigning for funding, that would be a strategic question that we need to propose, we need to put to the leader. I'm happy to take that question away and ask him to give you a written response, but similarly it might make sense for you if one of the officers gave an overview of how that works in practice or how that has done historically and where we get the sources of the funding from.
Thank you, that would be very helpful.
Thank you. Any other questions? Okay, Titus, would you be able to respond to that?
Yep, thank you, Chair. So I think just to add to what Councillor Thomas said there, we go through a process annually in terms of engaging with government. Government provides funding through various sources. One of the key ones for us is through the funding settlement, which is announced in December each year as a provisional settlement, and then we get final numbers which deliver our grant funding as an organisation in late January, early February. Part of that process involves a consultation that government runs around the settlement figures, and that's one of the key activities for us during the year in terms of lobbying around funding, is to respond to that consultation, highlight the cost pressures and funding challenges that the organisation faces, and obviously lobby for a larger share for Norfolk as an authority. We also engage with government throughout the year on specific funding streams, so various grants and funding levels to highlight the case and the need within Norfolk, but broader than that, very much as Councillor Thomas described, there will be other points of engagement as well.
Okay. Any other questions? Councillor Holliday, thank you.
Thank you, Chair. I must say, I find it quite difficult to, with the recommendations, given the lack of detail that we have at the moment. I mean, I'm looking at the budget book at the moment, which unfortunately, I fall asleep before I get a chance to read it. But, I mean, talking about the different areas in social care, I mean, I thought perhaps we would have a discussion about where the savings would be coming from in relation to those. I mean, I'd like to preface what I'm going to say is that as an ex-GP, I find the idea of taking a lot of money out of social care quite disquieting. So, but putting that on one side, because I understand the budget imperatives, I think it's slightly we're doing things backwards, that we should be having the briefing first and then making the decisions. Because, I mean, looking at this, you know, are you going to take the money out of communities and neighbourhoods or population health management, or, you know, where's it best and most effectively and less destructively removed? And I can't say with a whole hand on my heart that I can really agree with these recommendations without having that sort of detail. Thank you.
Councillor Thomas, can you answer?
Yeah, I can. Thanks for the comment. What I would say is the actual process for setting the budget was set out by Cabinet, and we're asking the committee to agree to the process. But what I would also say is the report here is not actually identifying savings proposals. So it's actually setting out the framework and the timetable, and the services will now go away and develop the proposals that will be considered by Cabinet. They'll be scrutinised by the select committees, and then they'll be subject to public consultation before any decisions are made. So it's a bit of a sort of circular process, but it will keep spinning back round. So I think you'll get a lot more detail on that by the time we come to the next meeting. Hope that helps.
Any other questions? Stunned silence. Okay, so before we turn to the recommendations, I would like to summarise the main points raised by this committee, and one of them being from Councillor Jack White, the update on finance, specifically to adult social services, and strategic campaigning for fair funding from Councillor Knight. Have I covered it now? Yeah, so they're the key takeaways from for adding to the recommendations. So turning now to the recommendations, which we will take individually, please indicate your vote by raising your hand, if you may, please. Number 1, we have been asked to consider the budget and medium-term financial strategy position as reported to Cabinet in June 2026, Appendix 1, noting in particular the following elements as set out in the appended report, which form the context for the 2027-28 budget setting. A, the budget gap for 2027 and the medium-term financial strategy period. B, the departmental savings targets. C, the overall timetable and approach to developing the 2027 budget. Does the committee agree we have considered and noted the relevant information? Please raise your hand if you are in favour. Unanimous. Thank you. We have been asked to provide input to the 2027 budget process in this meeting and in November, with the latter report providing an opportunity to comment on the detailed savings proposals being taken to public consultation. Does the committee agree? Unanimous. Thank you. We have been asked to consider the key issues from the 2027 budget setting as they pertain to the services within the Select Committee's report remit as set out in this paper, the appended Cabinet report and the 2026-27 budget book, and in particular to endorse the overall service strategies as set out within the 27-28 budget book, the budget setting principles set out in section 3 of the appended Cabinet report, which will provide the broad framework for savings development for services within the Select Committee's remit. Does the committee agree we have addressed the key issues highlighted, and do we agree to endorse the overall services strategies and the budget setting principles? All those for? Thank you. Unanimous. We have been asked to consider whether there are specific areas of activity that the Select Committee would recommend exploring for savings development in order to provide input to the 27-28 budget process and inform the saving proposals put forward to Cabinet later in the year. Does the committee agree we have adequately highlighted any specific areas of activity we would recommend exploring for savings development? All those in favour? All those against? You got that? That for?
4 against. Could you 4 again?
4. Can we do 4? 1, 2, 3, 4, 5. Yeah, only. Yeah, so that's me as well. Is that? I get casting vote. I'm going to use my casting vote on that, so it's carried. Thank you. I will now go back to the summing up and the update on the finance specific to adult social services. Was that a proposal, Jack?
Yes, there's a proposal to identify a breakdown by service types, not so adult children. I mean, like specific services, so supported living, nursing care, and looking at the expenditure for each avenue.
Okay. Well, do I have a seconder for that? Yeah. I got Councillor Biddington, yeah? Just going to defer to Becky.
Yeah, just to say, obviously, that me and finance colleagues have talked about that previously, so it would be a briefing session that we could hold, just so members are aware what we would be looking to arrange for you if you vote on this. Thank you.
Okay, so all in favour of that? I have a proposer and a seconder. Unanimous, thank you. And Councillor Knight, you had a proposal for a strategic campaigning for fair funding idea. Can you formulate? Oh, it's just a request. Sorry, I take that back. Thank you. Yeah, please.
Yeah, so because the councillor has had a request for further information and the cabinet member has said that she'll take that away, obviously what we'll do is we'll make sure that that response is shared with the committee. So it's not a formal recommendation, it's just an action to follow up from the committee.
Okay, are you happy with that? Yeah, thank you. Right, turning now to item 8. Oh yeah. If you wish to leave this riveting meeting, you may do so, and I thank you for your input. Thank you. Turning now to item 8, developing an oral health strategic framework for Norfolk. Derek, would you like to introduce this report, please? Thank you.
Thank you very much, Chair. Just to introduce myself first, my name is Derek Ward. I'm the Director of Public Health for the county. To my left is Dr. Sarah James. Sarah did a lot of the work on this, along with Cindy Marsh, who's my lead consultant in public health for all things oral and dental health. The reason I'm caveating this is the background to the report before I actually jump in the papers is previous Select Committee had growing concerns regarding views on children's poor oral health in some of our communities across the county, and the previous People and Community Select Committee for Norfolk, in actually towards the end of 2024, requested a members and officers working group to be formed to review oral health status across the county. That members group carried out that review in 2025, and what you have before you at the moment is the outcome from that review. So it's come from a previous select committee. So that's a little bit of the history. I'll drop back and just give the headlines, and I'll pass over to Sarah to take the committee through the paper, and then very happy to answer questions at the end. The report overall describes the background to developing a strategic framework, which is currently in draft, and we are aiming to complete it by December this year. That strategic framework will give us an action plan where we can target health inequalities as they pertain to oral health, and also how we increase the overall population's oral health. And I'll leave it to Sarah to give you a little bit of the context about why that is important. What we've taken in this framework is an all-age group. We tend to split a lot of the work that we do into children, young people and families, working-age adults and older adults. And you'll see in the report we've done that in terms of particular targeted interventions, because they are different for a number of reasons. However, the overall framework is to cover everybody in Norfolk. It's really important that we do that, but it's also really important to recognise that oral ill health is not uniform across the county. We've got a couple of maps in there. We've got some graphs and some diagrams that demonstrate the variability and the inequality across the county, which Sarah will take you through. So I guess that's all I'll say by way of introduction. I'll pass over to Sarah to take you through the paper, and then I'll wrap up at the end and get into question and answer session.
Thank you, Derek.
Thank you very much. So my name's Sarah James. I'm a public health registrar, which means I'm on the training pathway to become a public health consultant. Oh, is this one on as well? Sorry, I'll go on this one. And I did a placement at Norfolk for about 13 months, and I've moved on, so that's why I've got a slightly odd affiliation. And one thing I'd like to open with this report is that we're really looking at prevention and the kind of the public health approach. We're very aware of the issues with access to dental services in Norfolk, and we have been working with the NHS on their short-term and long-term plans for that. But this is looking at the other end of the pipeline. You know, how can we prevent these issues from ever needing dental input? Now, poor oral health it's not one of the large public health areas that people immediately think of, but actually it's really important in people's everyday lives, in eating, in speaking, you know, in learning, in work and in play. You can't do those things unless you have good oral health, which is why it's so important. And there's kind of three main aspects of oral health. So there's tooth decay, gum disease, but then also there are cancers that affect the mouth as well, oral cancers. And in the report on page 48 of the main report, you can see a table where we've summarised some of the data for Norfolk, the east of England and England. And there are surveys done in school of children. And so for 5-year-old children, about 1 in 5 in Norfolk has evidence of dental decay. A bit higher, so a bit worse than the east of England, about the same as England. And then when we look at older age children, so in year 6, that's kind of 10, 11 years old, it's 16% for Norfolk, and again, similar to England, worse than the east of England. And you might think perhaps that decreases somehow things are better, but it's just to do with how tooth decay works. So these 10 and 11-year-olds, they've lost their baby teeth, and then their adult teeth have only just come through, so they haven't had so long to be exposed, you know, fizzy drinks and sweets and poor toothbrushing. And then when we look in adults, although we don't have Norfolk-specific data, for the east of England, over half of adults have tooth decay. So again, this is a nationally done survey. So it's increasing with age, and nearly 90% of adults in Norfolk have some evidence of gum disease as well. So there's quite a burden of ill health. And in terms of oral cancer, we're similar to England, slightly below in numeric terms. And there is one statistic that doesn't quite fit with the previous pattern, which is tooth extractions are much lower in Norfolk, and that's something we're following up because it doesn't really fit with this pattern of higher tooth decay, and potentially it might be a data issue, or it may be, unfortunately, an access to dental care issue as well. So, as the County Council, we've got a statutory responsibility to provide or commission oral health promotion programmes, which is why this report is being discussed here, and to kind of monitor oral health in the county and plan. And we've done a quite in-depth data analysis, which I'll come on to later. And there's good evidence for measures to improve oral health. So first, to prevent oral health problems in terms of diet, avoiding sugar is the very main thing. Protecting the teeth through regular toothbrushing and getting fluoride onto the teeth, which kind of adds kind of physical protection. So whether that's with fluoride toothbrush, you can put fluoride varnish on teeth as well. And if the water has a high level of fluoride, that's protective as well. And then reducing risk factors for gum disease and oral cancer. So smoking is a major risk factor for gum disease and oral cancer, and alcohol is a risk factor for oral cancer as well, and the two kind of combine. So as well as all the other public health issues you have related to those, they worsen oral health as well. And then in terms of the evidence, we've got good evidence for the children. So there's a scheme called supervised toothbrushing, which we have in Norfolk, and we're scaling that up with some government investment. So this is where classes of children all kind of brush their teeth together once a day, and that kind of promotes toothbrushing and has been shown to be really effective. And for every £1 you spend on it, you get about £3 back cost saving. So that's without looking at kind of the quality of life. And similarly, providing toothbrushes and toothpastes to mums with young children. Again, that's nearly £5 cost saving if you target it well for every £1 spent. So in terms of what we're thinking of focusing on with this strategic framework, there's 3 areas. So there's children, adults, and then vulnerable groups. So in terms of children, we've already discussed the overall figures. And then we also have this map in the report on page 54. So this is showing the dental decay across the patch. So the areas that are more deprived, so this is something we kind of characterise as kind of an overall level of deprivation of an area based on kind of employment and income, education, housing, health, crime, the kind of the physical environment to give an overall deprivation score. And areas that score lower, there's also higher rates of dental decay. So Kings Lynn and West Norfolk, Great Yarmouth, parts of Norwich, and also kind of Thetford are areas where there's kind of worse deprivation, and that links in with where we see the worst dental decay in the young children. In terms of adults, the data, again, I said we don't have data for Norfolk, but the East of England data shows a substantial burden, over half with dental decay. Most people have had fillings, a lot of gum disease, about a quarter of people having oral pain, about 1 in 5 people having trouble, discomfort eating. So there is a big burden of disease there. And then there are certain groups that we know are more likely to have worse oral health, so people living in deprived areas, homeless, prisoners, asylum seekers, refugees, and people in care homes as well, and people with disabilities, so perhaps physical disabilities that make it harder for them to maintain good oral health, or if they've got learning difficulties and it's harder for them to do that also. So the framework is looking on kind of promoting prevention and interventions for these vulnerable groups, and also kind of with children, looking at kind of expanding the supervised toothbrushing program, and we're going to be developing this after your feedback into a kind of a finalised report and an action plan with the specific interventions that we're going to be focusing on. Yep.
So I'll just sort of summarise and then wrap up and we take some questions and answers. I think the important first thing that Sarah said is provision and access to dentistry is not something that we as a county council or myself as Director of Public Health have direct responsibility, or that we do certainly try to influence the NHS. It is something that's commissioned via the Integrated Care Board. Obviously, there is a big preventative component of dentistry, but it plays into the argument, which you'll hear me and you'll be sick of me saying over the coming years here, which is an ounce of prevention is worth a pound of cure. That was Benjamin Franklin in 1736. And every time I say that to people, they nod sagely, and then I say, can I have some money? And they say, no, no, no. We've got to spend it on all of the treatment. We fundamentally need to shift our focus to stopping people needing NHS services in the first place. And the point of the framework really is to provide that outline of what we need to do. Really important point that Sarah's articulated in the report is that we know what to do. The vast majority of oral ill health is preventable. Prevention is not only the right thing to do for the person, it's the right thing to do for the public purse. There's a slide in the pack that shows you that the vast majority of public health interventions are not only cost effective, they are cost saving. We spend now and we save more money in the future because we spent now. If we don't spend now, we save that money today, but we pay more in the future, and it's compounded. So we've got that as part of the report. So coming back to the key points, I think it's really important for the committee to take away. That point about almost all oral ill health is preventable. The way we prevent it is we reduce our intake of sugary and acidic foods and drinks. We protect our teeth through fluoride. That might be just fluoride toothbrushing, and we've got supervised toothbrushing programs, or it might be other ways. And we reduce our risks. And those risks are risks that don't just impact upon your oral health. They impact upon your overall health, both mental and physical. And they are things like smoking, vaping, and alcohol intake. So the draft outline for the Oral Health Strategic Framework for Norfolk has been brought to the committee for members' consideration, comment and feedback. The proposal from our perspective is for a conversation. We will then revise the framework and then turn that into an action plan. Thank you very much, Chair.
Thank you, Derek. Thank you, Sarah. Very well articulated. Thank you. Right, I'm going to open it up to the floor. Oh, yes, look at that. We're not at a football match. I think, yeah, Liz Withington first, please.
Thank you. First of all, thank you for bringing this strategic approach for oral health forward. It's really important, and it has so many ongoing impacts on other health areas that I think many people don't realise. So a very important report. I've got some comments rather than questions. I think, Derek, from conversations we have, you might possibly know something that I'm going to say. But the focus on prevention is, as you say, got to be our priority, not only for the improvements in health, but also health inequalities and savings. So I didn't see really a sort of a strong emphasis in this report on looking at how we can increase access to dentistry services. And by dentistry services, I don't just mean a dentist. There's so many broader services around there and so many opportunities for collaboration. Your colleague, Sarah, referred to fizzy drinks and that kind of thing. Well, that's working in collaboration with our children's support workers, etc., on diet and that kind of thing. So it's going to have to be very much about collaboration. So I would like to think that we could focus in this report on the need for the development and a strategic development of community health hubs and how the dentistry services can work within those. But one of the things, with another hat, I'm a chair of a health and wellbeing partnership, and one of the things that I'm very aware of is that lots of different community health hubs, whether they're mental health, whether they're more physical health, whether they're children's services, whether they're youth services, are all flooding into the market, shall we say, at the moment. And there's not really a strategic approach to how we can develop those. And I think this framework could be a good way of highlighting that need, because you could get a lot of services in. And interestingly, you raised as well about adults with learning disabilities. We know from the LEADER report that adult learning disability early deaths are far higher than they should be and can be justified. And it is a serious area of concern. But accessing health checks for that group, such as this, are vital. And those community health hubs and dentistry services are also a way in that we could tackle some of those issues. So I would really like to see if we could involve in this framework a more strategic approach to trying to develop the community hubs alongside the dentistry work and oral health work that we're doing. So again, thank you for the report. It's really interesting.
Councillor Knight and Councillor Smith. I'm going around.
Thank you, Chair.
Sorry, just 1 second. Did you want to respond to that at the moment? Yeah, absolutely. Yeah. Carry on.
Thank you, Chair. I'm sort of hoping to get some clarity on the choice not to consider access to or quality of dental services, because when we're talking about the broader strategic aspect of it, it won't be till 2027 when the dental school cohort at UEA will be starting. That means graduations won't be until 32, and that means these new dentists won't be lone practicing until 33 or 34. Does that not mean that we're sort of going into this strategic briefing a little bit blind, because we should be considering that timescale within our public health strategy? Thank you.
Derek, would you like to come back on that, please?
Yeah, just to try and pick up the dentistry, provision of dentistry, training of dentists aspect, because I absolutely agree. It's not an either or, it's a both and. We need to do everything we can to increase the preventative offer that's given, and that is the responsibility of the public health division within the council, and therefore falls within, I think, the remit of this committee. In terms of provision of dentistry, absolutely agree, and it is something that we discuss with our ICB colleagues, our Integrated Care Board colleagues, constantly. I think we talked a little bit about this previously, that if this committee wants that as an area to explore, then it's probably a conversation with HOSC in terms of who has that conversation with the NHS, and I'd be very happy to play into that. But I'm just trying to delineate a little bit the responsibilities of the county council as an upper tier, as a public health council, as compared to the NHS responsibilities, not disagreeing in the slightest about the importance of dentistry.
If I could just clarify my question, I'm more talking about, does this not show that there's a higher need for investment in the public health strategy because of the fact that we have the lack? It's the considering the fact that we have that lack. It's not that we are responsible for it, it's that it should be considered when we're developing our public health strategy. Does that make more sense?
It does make sense, absolutely. And the answer is yes, absolutely. As Director of Public Health, I think we should invest more in public health. No shocker there. I don't think that's going to make the front page of any newspaper. However, I think coming back to that point about we need to train more dentists, no question about that. In an ideal world, I will make myself redundant because everybody will live long, fit and healthy lives, and then, death and taxes, we know everybody will die, but ultimately that's the goal. If we can train a whole cohort of dentists that come out in 32, 33, and actually we don't need them all in Norfolk anymore because the demand has reduced because of all the preventative work that we've done, great, absolutely great. I've got no problem with that, and I'll have a fight with dentists about it. There'll be jobs for them elsewhere, I'm sure.
I can just jump in here. We did think this might come up as quite a big topic, and I have put together a potential recommendation that this committee asks the Health Overview Select Committee prioritises a report on access to NHS dentistry in Norfolk when it next reviews its forward work programme. I will put that forward for a proposal in a second or after I sum up, but just throw that out there, and I'll ask Becky to do that. I've lost track. John.
Thank you, Chair.
Sorry. Yeah. Carry on, John.
Thank you, Chair. No, firstly, can I just thank officers and colleagues for this report. I think it's a very useful and quite a impactful report, isn't it? And in Great Yarmouth, I know what a massive issue this is. You can see the deprivation on the map on page 54. And in my other role, I've spoken to people that have ripped their teeth out because they can't get access to a dentist. Fully recognising our remit and our scope around this as a county council, I just wondered if we can consider everything in our toolkit that's available to us to try and put extra pressure on the ICB. I know the MP for Great Yarmouth has contacted the ICB on countless occasions about access to dentists. I think it was a welcome decision that was made up at the UEA, finally, to use that site. But I also pick up on Councillor Witherington's comment there about community hubs, which I think is another excellent suggestion. In Great Yarmouth, there's a building called The Place, which the County Council and Great Yarmouth Borough Council supported. And Derek, you might be aware, there's a whole floor that was ring-fenced for training dental hygienists, I believe it was, which is currently sat empty. I think this is a massively underutilised and missed opportunity for us there. And I know colleagues at Great Yarmouth Borough Council are really keen for us to utilise this space. Is there anything we can do as a county council to put pressure on the ICB or other services around that? Then the last question I would just say is there anything we can do across Norfolk to perhaps hook in all the MPs in Norfolk to put extra pressure on the government for this? Sorry, so long, Chair.
Thank you, John. Can you come back on that, Derek?
I think the suggestion about Health Overview Scrutiny Committee that does have direct responsibility can
and I think
do that.
They could address that with the ICB, couldn't they? Yeah.
And obviously, as DPH, very happy to feed into that conversation, both explicitly and implicitly into the ICB through other routes as well.
Thank you, Derek. Thank you, John. Councillor Smith, you had your hand up?
Yes, thank you very much for the report. I note that you've quantified some vulnerable groups. I just wondered if you consider that adults who have declining oral health due to lack of dentistry could be included as a vulnerable group.
Sorry, Derek.
Well, yes, absolutely. It's a sort of chicken and egg argument, isn't it? Because the preventative work that we need to do that will reduce the need for dentistry almost always goes where that's lower is where it's needed more. So in public health we have something called the inverse care law. So it is generally those people who need the lower access to services tend to have greater access to services for a whole range of reasons. It could be another conversation we want to have as part of the forward plan. And those people who need it most tend to get it least. Partly that is because the NHS is a universal free at the point of care model. And one of the directions of travel from the government through the 10-year plan, which also talks about neighbourhood health. And I think neighbourhood health is a real opportunity to bring together all of the different hubs and local areas into one centralised resource. But part of the argument there is we will need to, as a society, differentiate and provide more resource into those areas that need it most, which means other areas that maybe don't need it as much will get fewer resources. And that is both politically and from an ethical perspective quite a difficult concept to deal with. What we've tried to provide in the report is some evidence about where we would want to put more resource in. The question is whether we want to pay more so that we can keep the level as is and put more resource in, or whether we need to move resources around. And obviously that is both a national and a local political conversation.
Okay, thank you. Councillor Holliday first, and then Councillor Clancy, and then I'll move on.
That's very kind, thank you. 3 questions. What in this framework addresses the sugary food issues? Because I feel, and it may not be within our remit, but it's incredibly important for lots of different reasons. Why aren't we fluoridating water, given that that's the best return on that graphic, and Anglia Water does fluoridate water in some of its regions, not in some of its counties, not for us, but I wondered if you could explore that. And what's the strategy in high-performing areas, such as Cambridge? I mean, Cambridge is probably a completely different demographic, but there are high-performing areas here that aren't necessarily very different from us demographically, and I would be keen to explore those. So 3 questions. Thank you.
I'll let Sarah come in on the last question, and I'll give her a second to think about that one. In terms of the fluoridation question, that responsibility for fluoridation lies with the Secretary of State for the Department of Health and Social Care. At the moment, the proposal is being taken forwards for the North East to be fluoridated, and if that is a successful rollout, then pretty well every area through their Directors of Public Health have got their hand up saying us next, us next. We have already explored that for Norfolk. I've already explored that for Norfolk even before I started. And the answer is we need to see how it goes from the Department of Health. Is we need to see how we go in the North East. But I agree with you. And coming from being the Director of Public Health in Lincolnshire, half of which is fluoridated, half of which is not. When one looks at the decayed, missing and filled teeth in children in deprived areas of Lincoln, which is fluoridated, and compare that to the deprived areas of Boston, quite similar, different backgrounds, but similar levels of deprivation, and Boston isn't fluoridated, you see a massive difference in the number of decayed, missing and filled teeth. So it's very clear that one of the drivers is fluoridation of the water supply, but it's a national debate, that one. Sorry, I've forgotten the first. The first one was sugar. So what we can do is we can raise awareness. We can help people understand the impact of sugar and sugar intake in terms of oral health. You're absolutely right. In terms of food formulation, it's a national issue. There was, about 6 or 7 years ago, quite a big push on this. It has gone quiet, and again, it could be something that as a committee, if you wanted to write to the Secretary of State to ask about what more could be done around food formulation at a national level, it would be in your gift. But I'll pass over to Sarah to answer maybe a little bit more on the sugar and then go on to the final question.
Yeah, so I think most people are aware of the sugar tax, and that has actually had a really positive impact on children's dental health. And there's also kind of national work on guidelines around the food in schools as well. And then I did want to touch on the fluoridation. So I think one thing, and this is a common thing in public health, is if you're asking someone to do something, like, you know, brush your teeth twice a day with fluoride toothpaste, again, the people who need it most are the people who are less likely to do it. Whereas if you've got something like fluoride, which is just in the water, and you don't need to do anything, then it really targets people in the more deprived areas. So it reduces inequalities because everyone gets it. You don't have to, you know, actively do something yourself on it. And then in terms of other areas, I think it's a bit complex. I think deprivation, again, the kind of the underlying different demographics plays quite a big role. I don't know, I've not worked specifically at Cambridgeshire County Council, but I do know they had a much more expanded supervised toothbrushing programme than's present in Norfolk. So I think, you know, these public health interventions as well, kind of expanding them is a major thing. But I think there's always going to be kind of the undercurrent of the demographics that is at play with those area differences. But I think also the kind of how much of a public health focus is on the issue is really key as well. And I agree with everything you said, of course.
Thank you, Sarah. I did have just quickly before we move on to more questions, I did preempt this a little bit, thinking this might come up, the fluoridation, because I too, Councillor Holliday, had a look on the map, and we don't have a lot anywhere in Norfolk. So I've put together a recommendation. This committee requests that the Democratic Support and Scrutiny Manager draft a letter for the Chair to send to the Department of Health and Social Care in support of water fluoridation in Norfolk as a way of improving oral health and reducing health inequalities. So I'll put that forward as a proposal when I sum up. Councillor Clancy, and then White, then Knight. Thank you.
Thank you, Chair. I'd like to associate myself with the comments of Councillor Withington and Councillor Wedden. I think this is an excellent report. It goes into detail and it will help. But I think going forward, it can't actually deliver the necessary improvements unless we force the hand of the ICB or its successor or the NHS. Because in isolation, I agree, prevention is definitely better than cure, 100%. But if you look at some of the figures there, I would say, and I would question that some of the data is questionable, because lots of young children frankly don't have a dentist and they can't have access to a dentist. And you have to say who surveyed them and when were they surveyed. I mean, I grew up my own grandchildren, for example, can't get an NHS dentist. Norfolk is a dental desert, and it's right that, yes, I agree, we need to refer this particular topic to HOSC, and it's the right thing to do. But it is absolutely a coordinated and integrated approach needed. Constantly talking about it will not achieve it. I mean, if you look at the dental school at the UEA, we started actually talking about this, and it was provisionally agreed in late 2022. We're now 2026. We're not actually going to start building to 2027. So it's a failure of government. And I'm not talking about Labour government, Conservative government, Liberal government or anything. It's a failure of coordinated thinking of government. In the financial year 2024-25, there was an underspend in dentistry in Norfolk of £18 million. Now, people like me wrote to the ICB and said, look, we can use this 18 million, we can incentivise private dentists, we can take them on temporary contracts, we can find ways of actually doing it. Basically, nothing happened. We've got these community hubs, which are an excellent thing being rolled out. The community hubs, dental care, healthcare, preventative work going on in communities. But the reality of it is, as Councillor Wedden has alluded to, we built the premises, but we can't man it. And this is a failure of the system. It's not a failure of any one individual. It's the system not talking to one another. It's the system not being coordinated. And millions upon millions of pounds seem to just get lost. £18 million. Look how many people could have been actually treated for £18 million. A lot. But of course, it gets bogged down in the bureaucratic nightmare between the various agencies which don't get their act together. And I would implore our new director to work with the ICB, work with a joint strategy of prevention. Obviously it makes sense. Everything has been said in this chamber. Everybody's agreeing. It definitely is a good report and it definitely makes sense to actually try to achieve prevention. But unfortunately, we're not getting to a lot of the people who need, inverted commas, the cure, because millions of pounds are being proliferated in talking about it rather than doing it. And I think, again, Councillor Withington or Councillor Wedden said it's important to engage all MPs, again, to push them hard to actually ensure we actually make these things happen. Because millions of pounds get wasted and we don't actually deliver on the promise. Great report, but we need to go further. Thank you, Chairman.
Thank you, Councillor Clancy. Would anyone like to come back on that? No?
So not on the main point, which I think, you know, others have raised and is very valid, and the chair has a good, I think, starting point for that, but just on the issue of data quality. So these surveys of children, they're done in schools. So the assessors will come in and they will check the teeth of all the children in the class. And so that's how we know that it's representative, because it's of the children in that school. So that aspect of the data doesn't rely on access to dental services.
Councillor White.
Thank you very much, Chair. Thank you very much for the report. It's very detailed. I noticed with some of the breakdowns, I'm going to just, for this moment in time, focus on adults, predominantly those within a care-based service. So I've noticed that one of the links provided from NICE shows that there's no update since 2018 on their recommendations for this. However, I noticed that you haven't referenced anything from the Smiling Matters CQC report in 2019, which was aimed at adult residential-based services, which was designed to implement a learning and development strategy for care providers to encourage promotion of oral hygiene throughout their services. Now, to me, this is a bit of a chicken and egg sort of situation, because The care providers have a legal obligation to ensure that they're managing that person's health and well-being under regulation and law. So as part of commissioning, we should be enforcing that, making sure that we're holding the providers on the frameworks to account and ensuring that they are following through with that, because that's something we are, as a county, paying them to do, to ensure that we're meeting that person's health and well-being. Now, I'm going to sound a little bit doom and gloom here, but for two seconds, I promise. Since a child, I've known sugar's bad for my teeth. I'm pretty sure a lot of adults, when you speak to them, know sugar is bad for their teeth. But we also have to look at what I'm going to call first world deprivation, if you will. Like, we live in a world where people can buy a double cheeseburger for like 99p, and a lettuce is that similar amount. You know. So if you're a family on a low income, you're going for the food you can afford to buy, because at least you're feeding your children. I mean, the schools have worked quite hard on this with sugar-free snacks, trying to encourage parents to not send in, you know, kids with sugar-based juices, even to the fact that they limit it down to water. I mean, the fluoridation sounds great, but obviously not everyone is going to agree with that, because you do get skeptics about putting things into the waterways, you know, but you can't argue with the stats on that as well. I'm just trying to understand where the balance is here, because we all know that there is a lack of dentists within the area. But there's major provisions which, in my opinion, are being missed. So we see how many GP surgeries with empty rooms. They are a registered healthcare centre under registration. Why don't we look at investing in community-based dentists, like we have community nursing teams, community midwives, who can circulate around these GP services in these empty rooms? Surely it must be cheaper in some aspects to put some equipment in there and have a sort of rotating dentist who can go from town to town on some form of appointment, and that gives people that open opportunity. Now, I represent Watton. There's one dentist in Watton regularly, and the chair, Councillor Kuel, you're also a district councillor for Watton. You see exactly the same information I see. People have to travel over 40 miles each way to get dentist appointments. And if you have no access to transport, you have no access to get to that appointment, so to speak, whose fault is that? Is that the individuals not taking care of themselves, or is that the system failing them?
Derek, would you come back on that? Thank you.
Yeah, I'll start with the Smiling Matters report. I think it's a really good point to make. I don't know whether Sarah looked at it as part of the background, but we can certainly look again. I'll talk at a general sense. One of the things that we had in Lincolnshire that I'd be really keen to strengthen here is support into our care homes, not just around oral health, but around things like hydration, things like protein first, which helps to maintain muscle mass, for example. So there's a whole range of different things that most care homes would love to do, but either don't have the capacity, the capability, or the understanding to do it. And we need to help, but I agree equally, and Nick might want to speak to this, we also need to recognise that they are registered and there is expectation on them via the CQC. So I don't disagree with that. In terms of some of the wider points, I think we've covered that, because that interface with the NHS, whether it is how dental services are commissioned via the ICB, or actually more innovative, different models to provide, we do have the opportunity. I'm 100% with you there. And I think the neighbourhood health proposal, thinking differently about how we deliver that, is going to be key. In large rural coastal counties, I'm used to Lincolnshire, I'm learning a lot about Norfolk now. It's always going to be an issue, because certainly in parts of the county, we can only look at services 180 degrees unless we're going to deliver services on boats, and that's not going to happen. So there is always going to be restrictions. We've got to be different. We've got to be innovative. So I absolutely agree with that.
Thank you. And sorry, just a point of reference, look at Skills for Care as well, because Skills for Care, I know that they put some training programs on for this many years ago, which they was, I'm not sure if they was funded for providers across the country, because obviously it's a national, but it might be worth looking at.
That's great. We absolutely will. I don't know whether Sarah, you wanted to mention anything?
Nick.
Great, thanks.
Thank you. Yes, I'll just add to it. So just to introduce myself, I'm Nick Clinch, Adult Social Services Director of Transformation. I think your point is really well made. So the NICE guidance, as you say, it has not been updated in recent years. However, there is still some really important recommendations in there about the way that providers should be doing care when they're doing care planning, considering oral health as part of that. Enhanced health in care homes has been a national initiative around some of this and around hydration. I think for me, what I'd like to see as part of this work is there have been some really good examples in Norfolk of targeted work in local areas around dentistry and oral health support for care homes. In particular, there have been some tests in the West Norfolk area, but I think it's about what examples of those could be looked at across the whole county, so it isn't just you get a really good local support offer if you live in a particular part of the county. So I think although the NICE guidance is out of date, we absolutely should still be emphasising the importance of it, so that when it is then updated, there'll be additional things added to it nationally, but that doesn't mean it's not relevant here and now for care providers and for commissioners, exactly as you describe.
And I think this is something, Councillor White, that we can bring back to, or bring to the Forward Work programme after this meeting. Councillor Knight.
Thank you, Chair. I want to add myself to the list of people praising this report because I think it's brilliant when you manage to get such a range of political views agreeing with each other. And I just want to touch on Councillor White's point. As somebody that used to work in dementia care and in autism care, I found that the online training for dental health, for helping people brush their teeth, was pretty poor. And generally, as somebody that's worked on the ground, I found that most people weren't getting their teeth brushed, whether that be to them refusing to brush their teeth. That is often with dementia patients and with patients with learning difficulties. But I think there needs to be a more robust way that we train our staff to do dentistry care. But that's a side point. I've been thinking about maps since this committee will learn I really love a map. So on page 54, I'm just interested in why Norwich South appears to be much more severe than Norwich North, and I was hoping that we could perhaps have a breakdown of dental decay among 5-year-olds or among the population generally that's sort of broken down more into reducing inequality target areas. Would that be possible?
Yeah, absolutely. I wonder whether we have something called the Norfolk Insight website, which, if you like maps, you can create your own. It's great. And one can go down to the lowest level where we actually have data, because sometimes the data just doesn't exist, or sometimes if it is a sampling data, we can only have confidence when we aggregate it up. If you try to go down too low, it's incorrect. So very happy to have that conversation either in a formal session or in a briefing session, or do it whichever way that you would like, Chair.
Yeah, we can explore that as a briefing or as a training session. Okay, Councillor Smith.
Thank you. You will have had many preventative health campaigns in the past. I'm just interested in where I can find the results of those, how they're measured once the campaigns are finished, to give us an idea of the outcome that might be expected at the end of a campaign.
We can certainly look at some of the national data. There have been research papers that look at various different campaigns, and the overarching evidence is that there's a national campaign with local amplification and particular local examples is the best way to help people to change their behaviour. But ultimately, a campaign's a campaign. As Councillor White said, public health is not complicated. If it was, I couldn't do it. We know that we should eat a healthy diet. We know we should exercise. We know that we shouldn't drink alcohol or smoke, and yet people still do. It's about trying to create the environment within which those healthier choices are more accessible, more cheaper, really, and to some extent are the default. So it comes back to that point about we need to get people to brush their teeth twice a day with fluoride toothpaste, but actually if we fluoridated the water supply, it's a both. Don't get me wrong, we should do both, but then people will get that fluoride through other routes. So happy to, again, look at that and maybe bring a briefing paper outside of the meeting.
Thank you, Derek. Jack.
So this is just a very quick one. I know years ago with spina bifida, they looked at putting things like folic acid into flour and stuff like that to help reduce the rate. Is there a way that, I mean, I'm not a scientist on this, so please shut me down, but can fluoride be introduced into other sort of food sources or substances outside of water?
You're not a scientist, me neither. Public health is a science and an art, so the international evidence is that fluoride in water was the most effective way, but now with supervised toothbrushing and fluoride toothpastes, in terms of population level impact, which is where public health is, that is the most effective way to actually to tackle that preventative component at the moment. That doesn't mean things won't change. You know, the nature of research is we think this today, we do research, and then we tailor, and there may be other options, but I'm certainly not aware of anything. I don't know. There's nothing that's come up through my routes.
Thank you.
Councillor, yeah.
I just want to say thank you, everyone who's here today. You've raised some fantastic points, and I'm just trying to soak it all in as Vice Chair, and hopefully maybe one day I'll be up there with you, Tina. I feel a little bit distant. Yeah. But what the point I'd like to raise about fluoride, Derek, is there any ramifications in terms of, so if we bring in fluoride, is there a measurement system of too much or too little? How can we ensure that there is enough in the water supply that people aren't receiving too much? So is there any health ramifications, for example, to receiving too much?
Yeah, there's long-standing evidence about what the appropriate level of fluoride in the water supply should be in terms of maximising oral health. There are big swathes of the country that do this. There are naturally fluoridated water supplies. There are water supplies where the fluoride is added. So there is a huge range of expertise to do this. As I said, it's a Secretary of State decision whether they want to do this at a big scale. But we know what we should do, and we know the benefits. Absolutely, there would be no issue with that.
I think what's actually come out of this very crystal clear is that we need to really shout and beat the drum loudly about NHS dentists and the fluoridation of water, and single-handedly those two things could cut those statistics down in the report massively and improve the health, thereby saving money, which could in turn go back to public health. You never know, it goes round in circles. So I'm very grateful for all these questions, and it lead into some good outcomes that we will vote on in due course. Is there any other questions before I go on to these recommendations? No? Okay, so members can find the recommendations we are considering today on page 46 of the report. And I would like to summarise, which I have done with the ones I've added in. And I think we've got some good actions that Becky is going to crack on with briefings and some training, etc. And the breakdown of the adult social care costings. So turning now to these recommendations, which will be taken individually, please can you show your vote by raising your hand. We have been asked to review the content of the report around the draft strategic framework aimed at improving the oral health of the Norfolk population. Are we in agreement? Yep, unanimous, thank you. We have also been asked to comment and provide feedback on the proposal to revise and finalise an oral health strategic framework for implementation from January 27. Does the committee agree we have adequately done this? All in agreement? Okay. So moving on to the next two, the potential recommendation regarding scrutiny of dentistry. This committee asks that the Health Overview Select Committee prioritises a report on access to NHS dentistry in Norfolk when it reviews its forward work programme. Do I have a seconder for that? Thank you, Mr. Clancy. All in favour of that? Thank you. The next recommendation, this committee requests that the Democratic Support and Scrutiny Manager draft a letter for the Chair to send to the Department of Health and Social Care in strong support of water fluoridation in Norfolk as a way of improving oral health and reducing health inequalities. Do I have a seconder? Thank you, Councillor White. All in favour? Thank you, that's unanimous. Right, moving on to item 9. The Forward Work Programme. Becky, would you like to introduce this report, please? Oh, sorry. Sorry, Councillor Clancy.
Chair, just a quick one. We did also meet the idea of us, yourself as Chair, writing to getting LMPs engaged with pushing forward the dentistry services in Norfolk. I appreciate, again, it's not strictly speaking the role of this committee, but it certainly can't do any harm. So I'd add that as an additional proposal, if you're happy to take that, Chair.
Okay. Yeah, no, is that, do I have a seconder for that? Yes, thank you, Councillor Whedon. All in favour of that? Yep, thank you.
Could I actually strengthen that slightly? With all due respect to you, Chair, and I do mean that, it would probably be better coming from the leader of the council, if possible.
Then you'd need to change. Sorry, shall I?
Yeah, I'm going to hand over to Becky.
I am great, sorry. Yeah, so as a committee, obviously, you've just passed a recommendation that this committee will write to all MPs about that. If you wanted to consider a further addition, which would be to ask the leader to do that, then you'd have to pass a separate recommendation, just to clarify that we want to keep the two. So you'd be asking the leader to do that, so just to be clear.
So for clarity, we've already voted to individually do it, and if you want to make a proposal to ask our leader to do the same, then that's, yeah.
I do, absolutely, yeah.
Do we have a seconder for that? Yep, Councillor Whedon, all in favour of asking our leader to write to? Yep. Any abstentions? Okay, Councillor Holliday, thank you. Any against? Okay, carried. Thank you. So now moving on to Becky for the Forward Work Programme. Thank you.
Thank you, Chair. The Forward Work Programme report is in your document pack on the agenda at page 60. Obviously, it's a continuing committee, so what you have in front of you is the work programme as agreed at the meeting in March 2026. The recommendations for the report are obviously to consider that, but with the caveat that we will be having a forward work programming session straight after this meeting once we've had a briefing from Adult Social Care, so that you can have an annual review of all of the items that you've got on that forward work programme, with a view to bringing back the items that you as a committee want for September and the rest of the civic year, and to have that agreement. So I'm presenting to you what has previously been agreed, and the action is to review and agree it, subject to having that formal work programming session that I'll lead with you once this meeting concludes. But happy to take any questions. Thank you, Chair.
Any questions on that? Because I think there'd be more chance to sort this out after the meeting rather than going through it all now. So are we happy to just move that to the meeting? Thank you, Councillor Knight. Yeah, can I have a show of hands to agree that? Thank you, unanimous. Okay, well that leaves me no further business, and I thank you all for your time today and coming to this meeting. And the next meeting of the Adult Social Care and Public Health Select Committee meeting is held on Wednesday the 9th of September. I would also like to thank the staff, Becky, Megan and Abby, who's in Crete, for doing such a sterling job on getting us all ready for this first meeting of the Select Committee, and thank the officers for their time and effort in producing these good reports. So thank you all, and not forgetting the Cabinet members. And you lot.
And the Chair.
Thank you. Finished. Thank you.